right. Hello, everyone. We are back with another session of our virtual career exploration series. This month, we are joined by Sean Dujensky, who is the supervisor of MRI at ProHealth Care, and he's going to talk a little bit more about radiologic technologist careers and then dive into more detail as far as his role at ProHealth Care goes and the MRI specialty. So Sean, I'll turn it over to you. You can kind of more formally introduce yourself and then dive into your program today. So thank you for being here.
Yes, thank you. So yes, I'm going to talk about Radiologic Technologist. So in this PowerPoint, we're going to discuss all the Radiologic Technologist job opportunities there are. We'll also discuss the education options to become a Radiologic Technologist. And then at the end, I'll kind of hone in down to my specialty, MRI, and we'll kind of do like a day in the life of an MRI tech. So as you said, my name is Sean Dujensky. I'm the MRI supervisor here at ProHealth Care. My background education, so I have a bachelor's in science in radiologic technology from Marian University. My second 2 years were spent at UW-Madison School of Radiologic Technology. My credentials, so I'm certified through the American Registry of Radiologic Technology as a radiographer, meaning an X-ray tech, as well as an MRI tech. I also have a specialty certification for MRSO or a MRI safety officer. There are some very special safety concerns around MRI, so it's important to have safety policies in place for that. My career history, I started out at UW-Madison. I went to school there my last 2 years. When I was in school, I was an MRI imaging assistant. So that was a second shift job after work. And it was mainly me working with one other technologist, and he was really cool. He taught me all the ins and outs of MRI and how to scan. So by the time I graduated Rad Tech school, I was able to scan almost all MRIs. So that in turn, I got a job as an MRI tech immediately after school. So I was an MRI tech there for another 2 years. Before coming over to ProHealth Care, I've been here for about 8 years, 3 years as an MRI tech, 3 years as the lead MRI tech, and I've been the MRI supervisor for about 1.5 years now. Why I chose to be a radiologic technologist. So if I go all the way back to high school, I knew I wanted to get in the healthcare field. I wanted to help people. I knew there was good job security. People are always getting hurt or sick. And most people, when they think of healthcare, they think you could be a doctor or you could be a nurse. So when I was young, that's kind of what I thought. I knew I didn't want to go to school to be a doctor, a little too much schooling for me. So I thought I'd be a nurse. So I got my certified nursing assistant license. And I worked as a CNA in a nursing home for 2 years when I was in high school. During that time, I realized nursing probably wasn't right for me. Just wasn't my right fit. But I also played a lot of sports in high school. When I played a lot of sports, I got injured. I had broke 4 bones, my leg once and my hand 3 separate times. So I had a lot of x-rays. And when I had those x-rays, meeting those x-ray techs, they all seemed very nice. They're all happy. And I thought, wow, maybe this is something I'd like to do. So I job shadowed at my local hospital one afternoon, and just seeing all the technology and all the different people, I knew that's what I wanted to do, and that's how I got started. So a radiologic technologist is a healthcare professional who performs diagnostic imaging procedures. There's several different modalities in radiology that rad techs can specialize in. So some of these modalities are X-ray, CT, computed tomography, interventional, MRI, or magnetic resonance imaging, and mammography. So one thing I'd like to note is the schooling you do to become any one of these is radiologic technologist. A lot of that schooling is geared toward X-ray. So when you're in school, you're going to be learning how to do X-rays. So if someone says they want to be an MRI tech or they want to be a CT tech, just know that you do have to go to school to be an X-ray tech first. You could get lucky and get a job in one of the other modalities immediately, but a lot of times you work as an X-ray tech for a little while before getting those other jobs as well. So an X-ray technologist perform medical exams using X-rays on patients to create images of specific body parts. They can do that with both plain films and fluoroscopy. Plain films are just like a normal picture, and fluoroscopy is a live X-ray, so it's almost like a video X-ray. In the upper right, there's an example of an X-ray tube in an X-ray room. So if an outpatient or an inpatient would come down, you position them in the room to take a picture of whatever body part you're looking at. The middle picture there is a mobile unit. So if a patient is too sick, say in the ICU or in the emergency room, if they're unable to leave their bed, you can drive the X-ray machine right to them and take the images there. And the bottom is an example of a fluoroscopy machine. So that takes those live X-rays. And they do those in surgery. They do those for GI procedures, gastrointestinal procedures, as well as arthrograms when you're looking at joints. So a couple examples of those. These are plain films, so just regular X-rays. This is a forearm. You can see right here, if you look close, there's a small break, but it's kind of hard to see. If you turn the arm 90 degrees, you can see that big break there. That's why it's very important for us to always take more than one pictures when we're looking at something. Help give them the best. This is lateral C-spine. So we're looking sideways at their neck. You can see their skull and their jaw and their bones. And this is a fusion here, metal fusion. This is a chest X-ray. You can see the ribs, the clavicle, the outline of the heart, the spine. If a patient would have pneumonia, you could see fluid down in there. One thing I want to point out with X-rays is they're very good at visualizing bone. You can see, like example, this break, very obvious. But if you look at the soft tissue, you can see it, but it's hard to demonstrate the difference between it. So it's hard to tell if this is muscle, if it's a fat, if it's a cyst, if it's anything else. So some of the other modalities look at soft tissue a little better. This is an example of fluoroscopy, those live X-rays. This is an arthrogram. So we assist the doctor. He puts a needle into the joint space and he'll inject contrast, and we use that live video to make sure we have the contrast in the right spot. Then that patient would go off to either CT or MRI, and then they get a really good look at that joint space to see if there are any issues with ligaments or tendons, make sure everything's intact. This is a swallow study, so a GI procedure. So this is the esophagus and the trachea. So what they do, we take live X-ray and they swallow food with contrast. That one you can see, it went down his esophagus right into his stomach, and that's a normal one. This one you can see some is getting down into his trachea, and that goes down into his lungs. So that could cause the patient to choke or could cause pneumonia or have all different types of issues. So the next modality we're going to talk about is CT. The CT technologist uses CT equipment to create diagnostic imaging of patients' internal organs and tissues. So they can look at patients from all the way from their head down to their toes. A CT machine also uses X-rays, just like conventional X-ray, but it's more like a focused slice of the X-ray to see inside. They also perform CT-guided biopsies. A very common one is a lung biopsy. So if there would be something in their lung that was suspicious, a physician would insert a needle right where they want to take a biopsy. Then they would take images to confirm they're in the right location. And when they are, they can take a biopsy and send that off to lab to see what's going on. So this is an example of angiography, or the arteries in a CT. So we inject contrast, it goes down the aorta and down into the legs. If a patient would have something blocking an artery, they could see exactly where it was blocking, and then there wouldn't be getting blood or contrast past that. They would also see if there was an aneurysm or a rupture in the artery. So if there was a spot where there was an opening and the patient was bleeding, they could find that as well. So the analogy I like to use with CT is a loaf of bread. So this is a patient's head. It's similar to a loaf of bread, where if you take the middle slice of bread out, that would be one picture and you could see inside. But when you put that loaf back or that slice back and scroll through, you get the whole image. So in CT, they have two different things, two different windows. It could be a bone window or a soft tissue window. So this one is soft tissue. So we're getting a better look at the actual brain itself, and the bone looks dark. And you can see it's slightly differentiating between the gray matter and the white matter in the brain. So if a patient would have a stroke, or if there was a brain bleed, or if they found cancer in there, that could be detected through these. So with this one, we get a little better differentiating in that soft tissue, whereas conventional X-ray, it was really just the bone we were looking at. Here's another example of a head. This one is a bleed in the brain. So on the left, it was the day of, that bright spot there. 10 days out, it looks slightly different. And then 20 days out, less noticeable. All right, so an interventional technologist. So they help physicians with minimally invasive procedures that guide instruments through patients' blood vessels and organs. They use a lot of live X-rays to help with these procedures. So minimally invasive, meaning they're not going to cut the patient open to go inside. They just make a small poke and they go in through a vein or an artery, and then they follow that artery up to the area of interest. So they do a lot of biopsies, they do needle aspirations, stent placements. This modality is a little more unique because they can treat patients rather than just help diagnose them. So in X-ray or CT, they just take a picture to see what's wrong. In interventional radiology, they can actually treat the patient there and make them better. So they are in sterile environments often. So you can see they're gowned up, they have their gloves and their masks and their shield. And this is an example of the live X-ray. If this was an artery here, if there was a blockage, they could see that blockage there, and then they might go in and open that up and place a stent to allow the blood flow to get to the right location for the patient. Or if they had an aneurysm and that vessel was bleeding, they could see that. And if it's bleeding, they can go in with an aneurysm clip or a coil, and they close off that artery and stop them from internal bleeding. A lot of times they work hand in hand with a nurse and the radiologist, the specialized doctor. A mammographer, they operate mammography units to produce images of breasts for diagnostic purposes. There's 2D mammography or 3D mammography. Tomosynthesis is the 3D. They also assist with biopsies. So if they find a suspicious lump, they can operate an ultrasound equipment to insert a needle right where that suspicious tissue is, and they'll take a biopsy and send that off to lab. So this is what that equipment looks like for the patient and the tech behind operating the equipment. This is an example of a 2D mammography and 3D mammography. On the 3D, you can see the spot they circled is a suspicious area, and on the 2D, it's a little more difficult to see. So MRI, I can get a little more in depth since it is my specialty. So an MRI technologist uses MRI equipment to create diagnostic imaging of patients' internal organs and tissue. So MRI is unique that it has no ionizing radiation, so it's not harmful for you. All the other modalities I've talked about so far can use radiation, so you want to use limited amounts. An MRI just uses a large magnet and radio frequency waves to obtain the images. We scan anything from the top of their head to the tip of their toe. And we also assist in biopsies. As mentioned, that breast biopsy, if it's in a tricky location or they're having difficulties finding it, we can, in the MRI environment, they can take a biopsy as well. So here are some of the more interesting MRI examples. So since there's no radiation, it's not harmful for a baby or a mother, so we can image babies inside the mother. This is an example of twins. So you can see the brain, stomach, the liver, and there's the sibling there, and they're already playing and kicking each other while they're in the womb there. So here at a normal hospital, that might be a very rare exam you would do, but if you got a job at a children's hospital, you may do one of those every single day. One of the more interesting ones we do is cardiac MRI. So we look at the heart. If a patient would have a heart attack, they want to assess the heart muscle and see the extent of the injury. So anything on this image that's bright is blood, and the dark here is the muscle. So this is the left ventricle and left atrium, and this is the valve here, allowing the blood to only flow in one direction and not back. So we take several different pictures of the heart to help them visualize that, and then they take all different measurements off of those. Another common reason we do an MRI is for Crohn's disease. Crohn's disease can affect your small bowel or your intestines. So what we do is we have a patient drink contrast, and it fills up their stomach and their intestines. And then we can take live videos of that contrast moving through their intestines, just like food would. So when your intestines move food through your bowels, it's called peristalsis, and it kind of moves it like a worm. So with these live shots, we can truly see it moving through. So the doctor would be able to tell if there was a blockage in the intestine, or if the tissue just didn't look healthy, then they know the area of concern. So all the modalities I've talked about so far are all places you could work with a degree in radiologic technology. Another one I didn't make a slide for, but I thought I should mention, you can work for a vendor like GE, General Electric, or Siemens. They create the equipment, and then they need people to teach people how to use it as well as sell it. So a lot of times they'll hire people that work in the field and use the equipment to do so. So you could be a sales rep or an application specialist. That is also a common job. So all of those other jobs you can get as a radiologic technologist. Some others I thought I'd mention that work in radiology, but it's a separate degree, are ultrasound, nuclear medicine, and radiation therapy. Each one of those has their own schooling. So you have to go to school for that specific modality. I do like that a radiologic technologist, you have more options. So you could work as an X-ray tech for a few years, decide you want to do something different. You could go to CT or MRI or wherever you'd like. Some of these other ones, you're more stuck in specific areas. So there's more options for radiologic technologists. Individuals considering a career as a radiologic technologist should excel in the math and science. So it is a degree in the sciences, so you will have a lot of anatomy, physiology, physics, different math classes. I would say if you're not strong in one of those in math and science, that is okay. If you truly want to become a radiologic technologist, you may just have to work a little harder in school. I wouldn't let that deter you. Communication is very important, as in many jobs. You have to communicate well with your coworkers, with the physician you're working with, as well as the patient. It's very important to let the patient know exactly what they have to do to get the best images for them. Critical thinking is also very important. The example I want to give, in a textbook, you'll read exactly how to take an X-ray, and it'll look very simple. You follow X, Y, and Z. And then you get to a real life setting and you realize that the patient can't do X or Y, but you still have to get to Z. So it's very important to use critical thinking to get the best pictures for these patients to help them out. So education. So you could get either a bachelor's degree or an associate's degree to become a radiologic technologist. As you can see on the screen, there are many schools in Wisconsin that offer this degree. For the bachelor's degree, your first two years will be spent with your prerequisites, so similar to any other degree. So you'll do math, science, English, all the generic classes that kind of prep you for your second 2 years. Once you get to your second 2 years, you'll apply for another X-ray program. So in my example, I went to Marian University for my first 2 years. and then I went to UW School of Radiologic Technology for my second 2 years. There are also associate's degrees. Associate's degree, you're really just doing the second 2 years from the bachelor's degree. When you do an associate's degree, sometimes they make you take 1 or 2 prerequisites before you qualify. They also, some of them have waiting lists, so you might have to do a little research on how to apply for those. I wouldn't say one is right, one versus the other. Both are good, associate's or bachelor's degree for this career. It really just depends on the person and what's best for them. Okay, so what does a day in the life of an MRI tech look like? So if it's a Monday morning, I have my coffee, coming to work, I get to work, I'm gonna go turn on the equipment. So one thing I wanna point out is the magnet is always on an MRI, so you're not turning the magnet on, you're just turning the power to the equipment in the room, the computers in the room, but that magnet is always on. The next step, you'll check your list of patients for the day, so you'll wanna make sure you have paperwork on all of those patients. You wanna make sure all the orders look correct. On a normal day, you may do anywhere from 5 patients to 15 patients, just depending how busy you are, what type of exam you're doing, or where you're working. After that, you'll do some QA tests. Every Monday, we do quality assurance tests on the machine. So we put these phantoms, these large canisters of a liquid, and then we run certain scans on them to make sure our equipment is operating properly. So after we have all that done, the first patient arrives, you'll go out to the waiting room, pick them up. You'll walk them back to a little prep area. In that prep area, you're going to go over a screening form. MRI, I mentioned that large magnet. There's also radio frequency waves that can pose some safety issues. So it's very important to go through all of these questions thoroughly. Like if the patient has a pacemaker, a stimulator, an aneurysm clip or coil. Just because they have those doesn't necessarily mean they can't have an MRI. It just means we have to make sure that it was tested for safety in MRI, and we may have to follow very strict guidelines when we scan that patient. So we may have to kind of dial the power back of the scanner. So once we've screened a patient and we know they're safe, we can take them on in the room. In this example, we're looking at an MRI of the head. So this is the scanner here. We place the patient on the table. This device here is a head coil. The coil is what helps us get the pictures. There's copper wires in there, and that's what gathers the data to create the images. So we give patients earplugs. If anyone's ever had an MRI, they know it's very noisy. We also put cushions around their head and their body to help them hold still, as well as make them comfortable. MRIs can take anywhere from 15 minutes to all the way up to like 2 hours. So it's very important to get them comfortable so they're not moving, so you get the best pictures possible. We also give them a call button in their hand because we will not be in the room. They can squeeze that ball, it'll set off an alarm, and then we can talk to them to make sure they're okay in there. So once we've confirmed they're comfortable and in the right position, we walk out of the scan room and head on out to our workstation here. And then we can sit at the workstation and prescribe all the images, as well as still see the patient through the glass. So this example of a head MRI, it'll display the 3 different planes up here, the sagittal, coronal, and axial. Whatever we're looking at has a different protocol. So the head will have a specific protocol. So there'll be several images here that we have to run through and set up. So we align them, make sure they're proper here. And then depending on which image we're looking at, we may have to adjust some parameters down here. So this is an example of some images of the brain. So the first one here is a sagittal T2 weighted image. So on a T2, the fluid is bright, and those really help look at anatomy. So they can look at all the structural parts of the brain and make sure everything looks normal. And we do that in the coronal plane and the axial plane. So all of these are the same image. They're just going through the brain right to left, front to back, and top to bottom. This specialty scan is called a DWI, or diffusion weighted image. This one helps us look for strokes. So if a patient would have a stroke, we'll see a bright spot on their head here. This one is called a flare. A flare helps visualize if there's edema or swelling in the brain anywhere, if someone would have a tumor or mets that would show up. It's also very good at finding MS or multiple sclerosis. So a lot of MS is also diagnosed through MRI. So once we're done scanning our patient, we have our images here. We would go in reverse where we go back in the room, pull the patient out, make sure they don't have any questions, and then we would walk them back. And then we would do the same thing on repeat for about probably 8 patients for the day. So the favorite part of my job is helping patients. A lot of patients, you're seeing them during some of the hardest times in their life. So it can be very rewarding when you can help get them through that difficult time in their life, and you can make it a little better for them. We do get a lot of reoccurring patients. So if patients have cancer, a lot of times they'll have 3-month, 6-month, 1-year follow-ups. So you're seeing these patients over and over, and you see them get better. You can form a bond with them. A lot of times they'll remember your name and have a good conversation with them. Another favorite part about the job is technology is always growing. I have some coworkers that have been in the field for 25 or 30 years, and you hear stories of what it was like when they started. To get one picture, they used to have to take a giant key, put it in the wall, and manually tune it. And then that picture would take 30 minutes just to get one image. And now to do that, it's 3 clicks of the mouse and 2 minutes, and you have the same or better image than that. So it is very interesting. New technology is always coming out. It's always growing. It's always getting better. The least favorite part about the job being the ones to discover pathology. So we do not diagnose patients with having anything. We leave that for the doctor, the radiologist. But in the other sense, we are trained to know what we're looking at and what we see. So in our example of our brain MRI patient, we could notice that they have a tumor in their brain that they don't know about. So after we take the pictures, we have to go in the room, help them up, make sure everything's okay, and take them on their way. You really have to have a good poker face. You can't lead on that you just saw something bad, because a lot of patients will interrogate you on what you saw, and it's important that you don't disclose any of that. Another part of the job I like to make sure everybody's aware of, working in healthcare, sometimes you do have to work on a holiday. You may have to work on some weekends, or you may have to work on call after hours. So if you're someone that grew up with parents that worked a 9 to 5 and they were always there on weekends, always there on holidays, just know that there are sometimes that you will have to cover those shifts. So here's MRI equipment. So this is the scanner. The table goes up and down, tabletop slides in. These are the coils, or those copper wires that pick up the images for us. There's a different coil for every body part. So this is a foot, this is an abdomen or a chest, a knee coil, and a head coil. So what does the schedule look like? So it really just depends on where you work. If you work in a hospital, a lot of times they're staffed during normal business hours, 7 days a week, so even on weekends. But after normal business hours, there's always someone on call. So they have to rotate taking call at night in case there's an emergency case. If a patient has a stroke and they need to image an MRI, or if a patient is paralyzed and they can't visualize the spinal cord on the CT, that's another reason why they would call us in. You could have a job in a clinic. They kind of work set weekday hours. They normally don't have to work on holidays or weekends or call. Here at ProHealth Care, we have several different shifts. Some of our shifts are 8 hours a day. Some of our shifts are 10-hour days where you'd work 4 10s. And we even have shifts that are 7 days on, 7 days off. So that one's great for people that are younger and would love to travel. You can take 7-day vacations without using any vacation time. So yeah, that's about everything for becoming a radiologic technologist. I have my email on this slide, so if anyone's watching this and you have any questions about anything you saw, feel free to reach out, and I have no problem answering any of those. Thank you very much for your time.